Hi folks, today we are discussing how you might know you have heart failure. More specifically, what symptoms do you have? And these vary from person to person. One of the very common things is shortness of breath. Breathlessness, finding it hard to breathe to do normal activities. So everyone expects to maybe be a bit short of breath if they say run up a hill or try and rush to catch a bus or something like that. But normally people wouldn't experience shortness of breath when they're just trying to change their clothes or shower, or they might be okay on the flat, but the minute there's a little bit of an incline, or the minute they hurry a little bit more, they feel that breathing much more. You might pant. At its extremes, this difficulty of breathing might be like finding it hard to eat. So when you eat, you're taking each mouthful, but you're having to stop and catch your breath and then try again. And it gets very fatiguing. That can be at a more severe level. There's also, say, difficulty breathing when you lie down for sleep, and maybe you have to prop yourself up on a couple of pillows. Maybe it's so bad that you actually have to sit upright. And I've definitely had patients like that who say to me, oh, doctor, the last few nights have just been so bad. I've been sitting up in a chair to go to sleep at night. And then when they say that, I'm like, oh no, that's, it's a really severe symptom of heart failure. They might even be okay when they lie down, they go to sleep, but then in the middle of the night, they'll wake up and they're panting, short of breath. They can't catch their breath and they feel really scared. And often that prompts a call to the ambulance. And, really by rights, if you're experiencing something like that, you probably should be calling an ambulance and going to hospital. Definitely get help for that. So what are the other types of things that people present with? Well, fatigue is a very common thing. Tiredness, just increased time to do normal activities. You're having to slow down. What I will commonly ask people is, say, when you're feeling well, what could you do before that you now can't do, or now you're finding it harder to do? If you can say to me, well, 3 months ago, I could walk down my street to the end of the street, but now I'm having to stop for regular intervals to catch my breath, or now it takes me 3 times as long, or yeah, I can do it, but I'm struggling. I'm feeling my breathing a lot more. Those are all important possible signs that you've got heart failure or some heart problem that needs further investigation. So do be really aware of if there has been pattern changes for you. And those are the things that you need to bring to the attention of your doctor, because they might need investigating. What are some of the other things? Well, very common thing is swelling of the feet, swelling of the ankles, swelling of the legs even. Some people will say they're even swollen up to their thighs. It can be higher than that. You can have swelling in your hands. So the swelling of the feet might present as, well, I just can't fit into my regular shoes anymore, and now I'm having to wear, these soft floppy shoes or slippers even. Can't tie my shoelaces up without getting these horrible marks and indents around my feet and ankles. That can be a typical way of seeing that you've got swelling and fluid in the feet. You might say, well, now my sock cuts in really badly, so I get this kind of little indent like this in my ankle. What are some of the bloating, as part of that picture of swelling legs, fluid retention, That could cause constipation, expansion of your belly, not being able to fit into clothes, but you're not obviously putting on weight. That could be another one. Less common things might actually be discomfort in the upper part of the abdomen, over the liver, that's on the right side of your like lower chest, upper abdomen. That can be due to congestion of the liver, so you might get pain there. You might even think that it's your gallbladder or some other thing. You could lose your appetite. You could be losing weight. You could be experiencing heart palpitations, dizziness. They're definitely like difficulty bending forward and coming back up again. So there's a variety of things. Now, there's a couple of like more tricky things that people present with, such as wheezing. So often when patients wheeze, the first thing people think of is, well, do I have asthma? If you have never had asthma in your life and you start wheezing and you look like you've got these sort of problems with holding water in your tissues, then it may actually be what we call cardiac asthma. It's really that there's fluid in the lungs, and it's not the typical form of asthma that we all know. And definitely if you never had childhood asthma, or you weren't a smoker and you don't have lung disease, then we need to think about, is it actually the heart and not the lungs? So that's another little tricky one. You might have problems with dizziness on exertion. You might black out unexpectedly. So, these are the less common things, but these are the range of symptoms that you might have if you have heart failure. And I think, next time we're going to talk more about how do we investigate that, and what would be your first steps. Who would you go to? Who would you see? And how would we know that you have heart failure? So I'll see you next time.